Our first speaker is Dr. Eric Hekler, who will speak to his experience evolving as a systems scientist to foster behavior change. Dr. Hekler is the director of the Center for Wireless and Population Health Systems within the Qualcomm Institute at the University of California, San Diego. He's also an associate professor in the Department of Family Medicine and Public Health and faculty member of the Design Lab at UCSD. Welcome, Dr. Hekler.
Very much. And I'm very excited to be part of this conversation. Particularly, I hope that what I present will build on. I hope you'll see that it builds on a lot of the conversations that I already had. So first, let me hit on my disclosures. I'm advisor to these groups and been funded by these organizations. And I also want to acknowledge that UC San Diego resides on the unceded territory of the Kumeyaay Nation. So moving into the talk, a key adage that I often like to use as a reference is, as paraphrase from Einstein, as simple as possible, no simpler. And in particular, that key point on no simpler, I think, is a really important part of this point. So when I was finishing my postdoc, say 10 years ago or something like that now, I was doing all the work and trained in all the ways on how to help promote health behavior change, randomized control trials, building digital technologies. And long story short, when I was finishing running those randomized control trials, I just started really thinking there's a huge mismatch between the complexity of the problem of trying to help people live healthy lives compared to the tools that we were using, in essence. And so you can kind of summarize this in terms of, at least there's these three orthogonal dimensions. One of them is basically that context matters. There's a lot of different factors, of course, as you're hearing from all of the talks that have been going on, from systemic racism to the built environment and whatnot, that have an impact on what people can choose to engage in and the types of activities people can do. Of course, also, these things are dynamic. Things change. And so there's a flow in how all of these different factors are influencing a person. And of course, then people become different. How change happens manifests differently with different people. For example, one child might see strawberries as a reward. Another child might see a strawberry as a punishment. This complexity was just not matched with the randomized control trial logic that I was trained in. And so for many years, I've been working forward on trying to understand, how do we basically live up to this as simple as possible, but no simpler mantra. And in particular, I must acknowledge and thank my close colleague and friend, Daniel Rivera, who actually invited me. He was part of the search committee, so I think he was in many ways why I'm here today. I went and basically saw a talk many years ago now of Daniel's, and I heard him talk about control systems engineering. And honestly, when I first heard the talk, I was like, I don't exactly know what he said, but I think that matches the complexity of the problem. And so he and I, for many years now, have been working very closely to figure out how can we use control systems engineering to advance a type of science that can match the complexity of human behavior change. But what I want to hit on is sort of these three layers of lessons learned in terms of my evolving thinking about this. And I'll unpack all of these. I'm sure they won't make total sense until afterwards. But one, focusing on verbs over nouns. Two, whoever defines success in categories has the power. And in particular, the question of, should scientists really have that power, or, as I think has been alluded already, should that power really reside with those we're trying to serve? And then last, thinking about a humanistic system science, which is sort of the way I'm trying to meld these two tensions. It can act more like a GPS in terms of tuning to context and less like a yardstick, and then cultivate appropriate mindsets, processes, and skills of scientists. So I'll unpack all of this, but just sort of think this is where I'm basically going with this talk. So first, let's talk about verbs over nouns. And so this is really why I got so excited about control systems engineering. So I won't have a chance to get all into how control systems engineering works. I'm just going to discuss kind of basically an overview on why it's important and why I think we should be engaging in it as a system science perspective. Long story short, control systems engineering is a large, pervasive field focused on making dynamic decisions in dynamic, often highly complex environments. And it's a key idea is that it's focusing on the dynamics of each individual system and how it works. So it's like, how does a specific boat for an autopilot or a plane or supply chain or thermostat or robot function within context to take into this into account. So to try to make this more relatable, particularly for, in the context of obesity, you can think about it as a control system is doing a lot of the stuff that a health coach would normally do. What does a health coach do? A health coach knows quite a bit of thing. They have a model in their mind about how the world works, why people engage in different health behaviors and contexts. They have a repertoire of tools that they can suggest, behavior change techniques, such as setting goals and rewards to help someone be physically active, for example. They have strategies to help a person monitor what activity they're engaging in. And of course, they can then make dynamic decisions. They can make adjustments based on how a person is responding. Well, in many ways, that's what you have to operationalize within a control system. On one hand, as we've been discussed at length with different type of systems models, we can build computational models that actually help to specify those beliefs mathematically. And what that does is it allows us to build simulation environments. And then within control systems, we have this tool called system identification, where we see and we actually build dynamical models based on the data of an actual person or any unit. It doesn't have to be a person, it could be a healthcare system or otherwise. But you can use this to actually then make simulations on how a person will respond in future instances. What happens if we give them high goals tomorrow, low goals tomorrow, and different contexts? What happens if the weather is good or bad and whatnot? And also taking into account individual differences, recognizing that for some people, when they're stressed, they walk more. For some people, when they're stressed, they walk less. For some people, stress doesn't matter. That can all be acknowledged in these models that we build. With that, this model can then be used as basically the thing to make decisions. This is what this controller does. In this context, it's a hybrid model predictive controller. And basically what it's doing is it's running all of these simulations and it's basically balancing the math equation. It's basically saying, which is the best decision I can make tomorrow, and whatever the time scale is for the work, that would lead to a person going and getting to our long-term success criteria. In this context, 150 minutes of moderate intensity physical activity, meeting the national guidelines. So this is how a control system works. We're basically mathematically specifying all this, right? Which I think is really interesting and exciting because it basically allows us to take into account context, takes into account that things are changing, and allows us to honor that people are different. And so using all this to actually then help them make better decisions. And so I think there's a lot of value with this, and we are continuing this line of work to this day. But I want to hit on sort of the unintended consequence that I really started recognizing many years ago, which was in essence, I realized that if we don't think very carefully about what we're building, we could be easily building control algorithms that manipulate people. And so in particular, this hits up the idea of whoever defines success in categories has the power. And I really have increasingly don't feel comfortable that I should be making those decisions. And this is built in many ways on another project I worked on, funded by the Robert Johnson Foundation with my colleague and friend Dana Lewis. In brief about Dana, Dana is a person with type 1 diabetes who does not have any formal training in engineering or science or in scientific methods, but she ended up with her husband, Scott, designing and building her own artificial pancreas system, open sourcing it online. And now there's several thousand people that have actually built out their own open APS, as this says, open artificial pancreas system rig. And she and the community has had a very large impact on improving care of persons with type 1 diabetes. So we got a grant, not focusing on that work that Dana did, but actually realizing there are many more people like Dana that we are systematically not including in the scientific discourse. And our focus was on trying to figure out how do we open the pathways of innovation for these non-traditional researchers and experts, particularly these people with the lived experience to understand these problems. And so I'm going to move forward now and actually talk a little bit now. There's a lot to unpack with this, but I want to really hit on this sort of question that we've been alluding to, which is this idea of we as scientists are coming in with systematic biases. We have these powers, these privileges, and in particular, I invite you to take a look and read this in more depth, this narrative of my own personal experience of basically overcoming my own confident ignorance and my own emotional blindness. Thankfully, I don't think I fell into the paranoia, but I think these are actually three things that often get linked together, and I think are particularly systemically problematic in our current world, that keep it such that we fall into frames of as if we're being objective, but we're actually creating greater problems. And so, for example, when we started the work, I fell into the assumption, well, I should be the PI because I'm the researcher. Well, no, this was Dana's science. Dana should be the PI. Or another one, we were running a convening with non-traditional researchers and otherwise. And at first I thought, well, I can play the role of synthesizing and trying to drive the conversation. Well, no, if I did that as a white male of privilege, I would have compromised our capacity to build equitable participation and contribution in that room. And so I took the role of a note taker, I think very much appropriately so. And there are many, many more examples of this, but learning how to actually learn the feeling and experience of being oppressed. And this is what I mean by emotional blindness. It's like when you're talking to someone who's never seen the color purple, it's hard for you to actually create a shared communication. You don't have that shared lived experience that is actually what the words represent. How do we start building that awareness of that? How do we get beyond our own confident ignorance that we might think we know or not, but we don't really know that much, right? And so in my mind, a key part of this is recognizing the mindsets and processes and skills we engage in. I don't have time to get into great depth, but I think these are three key concepts to think about in terms of being curious, compassionate, and humble. And particularly asking questions like, what else might be true? How do you know? And what is the next right thing to do? So I know I don't have much time. So what I really want to hit on in the end is sort of like, how do we link this into a combined group? Particularly, I've already hit on the mindset idea. I want to talk about this idea of act more like a GPS and less like a yardstick. So coming back to the control systems, you can see the success criteria we've been using is more like a yardstick. Get people to 150 minutes of moderate intensity activity. But that's not how dynamic systems work. You know, we are constantly making different decisions about, do we eat? Do we engage with others socially? Do we move? Do we think? Do we sleep? Right? And not only are we going between and trying to triangulate between these different things, there's a time when we should be sitting and relaxing. There's a time when we should be moving. There's a time when we should eat. There's a time when we should be fasting. There's a time when we should be alone versus others. You get the idea, right? And so this is what I mean by being more like GPS than a yardstick. To figure out what is good, what is success, you need to understand context. You need to understand what are the options that exist and start, as the word my colleague MC Schrafel and I are now using, tuning, which by the way is used very much in control systems as well. Tuning to figure out what is the right action in this given moment. And we're trying to build a behavior change process around that. So just to summarize, knowing I'm out of time, implications for system science for obesity include focus more on dynamic interconnectivity and flows within and across systems, individual units and context, i.e. the verbs, over interventions, levels, and outcomes, the nouns. Those served by science must take part in defining the success criteria and categories to enable trustworthy models and algorithms. Otherwise, we're building manipulation engines. Training in humanistic science is essential and likely should balance at the very least, on one hand, mathematics, computation, modeling, and algorithm development, with also cultivating humanistic scientists, mindsets, compassion, curiosity, humility, processes, including triangulation, studying root causes and iteration, and skills, fusion, diffusion, listening, and synthesizing. And I'm sorry, I can't unpack all of those. So thank you very much.